Hello, everyone. Today we will be discussing a Sentinel event, a patient safety incident that resulted in serious harm due to misidentification. This is a critical issue in healthcare, and we will examine the case scenario, its causes, and how we can prevent similar incidents in the future.
Our case involves two patients, Keisha Valdez, 22, who was scheduled for a lip filler procedure while Cassandra Valdez, 23, was supposed to undergo rhinoplasty. Due to a patient identification error, they received the wrong procedures. This mistake led to significant physical harm and psychological distress for both patients. Misidentification errors like this can have severe consequences both for the patient and healthcare providers involved.
Let's take a closer look at the two procedures involved. Lip filler is a non-surgical cosmetic enhancement that uses dermal fillers to add volume to the lips. It has minimal risk, but still requires careful administration. Rhinoplasty, on the other hand, is a surgical procedure that alters the structure of the nose. It involves greater risk, a longer recovery time, and potential complications if not performed correctly. The mix-up in procedures resulted in an unattended surgical intervention, leading to major health risks for both patients.
Nurses play a vital role in preventing patient identification errors. Accurate patient verification is critical in ensuring the correct procedure is performed on the right individual. Emotional support and counseling must be provided to patients who suffer from medical errors. Nurses should always follow proper identification protocols before any medical intervention.
The primary cause of the Sentinel event was failure in proper patient identification. The patients had similar names, which led to confusion. There was a lack of standardized verification processes in place. The busy clinical environment contributed to oversight by healthcare providers. These factors combined led to this serious medical error.
Several key contributing factors caused this error: no use of two patient identifiers, which is a standard safety measure in healthcare; breakdown in communication among staff members; absence of electronic verification before the procedures; human factors such as time pressure led to rush decisions. These failures highlight the need for improved safety protocols in medical settings.
The impact on patients were severe. They underwent unattended invasive procedures. They experienced psychological distress due to the mix-up. This incident led to a loss of trust in the healthcare system. When medical errors occur, it's crucial to provide patients with emotional support, clear explanations, and corrective actions.
Let's look at some statistics on patient identification errors. 13% of medical errors involve patient misidentification. Surgical mix-up occurs one out of every 112,000 procedures. 86% misidentification errors happen during patient intake or handoff. These numbers show how widespread this issue is and why we must implement a better identification system.
To prevent future errors, healthcare facilities should implement two identifier verifications before any procedures, barcode scanning for patient identification, standardized handoff communication protocols, pre-procedure timeouts to confirm patient details, electronic patient verification to reduce human error. These measures significantly reduce the risk of misidentification.
Nurses can take specific actions to enhance patient safety. They can educate staff on patient safety protocols, use bedside verification with electronic records, implement wristbands with barcodes for patient identification, encourage a culture of double checking before procedures. These steps empower nurses to act as patient advocates in reducing medical errors.
Hospitals must enforce strict policies to prevent patient misidentification, adhere to Joint Commission safety goals, conduct routine audits and compliance checks, encourage patient involvement in verification processes, implement clear documentation standards to ensure accuracy. These administrative changes improve overall patient safety and accountability.
There are serious ethical and legal implications in patient misidentification. Patients have the right to be informed consent and accurate treatment. Medical errors can occur in malpractice lawsuits. Healthcare providers have ethical responsibility to uphold safety and accountability. Failure to follow proper protocols can have legal consequences for hospitals and practitioners.
When a sentinel event occurs, emotional and psychological support is crucial. Provide immediate counseling for affected patients, offer compensation and support when necessary, maintain ongoing patient engagement to rebuild trust, encourage open communication to ensure transparency, and prevent similar errors in the future.
Now let's open up for discussion. Consider these questions. What additional strategies can healthcare facilities implement to prevent patient misidentification? How can nurses advocate for patient safety in high-pressure environments like cosmetic surgery clinics? What are the ethical implications of sentinel events, and how should healthcare providers respond to them?
To conclude, patient identification is crucial in preventing medical errors. Multi-layer verification systems should be implemented. Continuous education and policy enforcement minimizes risk. Patient-centered care must always prioritize safety. Thank you all for listening.